June is National Cancer Survivor Month. About 17 million people in the U.S. are considered survivors, those living with, through, and beyond their disease. That number is expected to grow by 5 million in the next decade, thanks in part to people like Dr. Paul Vandersloot, a surgeon at the Sarah Cannon Cancer Institute at Swedish Hospital.
So this group of cancer survivors is growing across the country, which is a good thing in many ways, thanks to early detection and treatments. Can you tell me a little bit more about that?
Sure. I think over the years, we've got cancers now that have very well delineated screening programs. Examples of that would be for colon cancer, lung cancer, breast cancer, cervical cancer, and now more and more skin cancer, which is important in Colorado, of course. So when we do detect cancers, we detect them more early, and in fact, patients do better. So we have more cancer survivors as a result of that.
So you spoke about the screenings for some of those common cancers, but actually a majority of the cancer deaths in this country we can't screen for. And how are blood tests now changing that?
So more and more we have relatively simple blood tests that can surveil for cancer, different cancers, can pick up certain genetic mutations that we know put patients at risk. So there are new ways to detect cancer up front, but also detect recurrences in patients who have already been treated for cancer.
And you mentioned this term earlier that I'd like to hear a little bit more about: survivorship, not just surviving cancer, but living well after. What this group of cancer survivors through survivorship, what people are doing. Can you tell me a little bit more?
Sure. This is a big part of cancer care evolution in the last several years, really a focus for all of us that manage patients with cancer. So, obviously when we treat cancer, our first goal is to cure the cancer if possible. I think more and more beyond cure, we sometimes treat cancers so that patients live with cancer and can live with that for quite a long time. So it's not only about treating the cancer, it's about how do patients live after they've had cancer. So that includes things like, in our case, I'm a head and neck surgeon, so how are patients swallowing? What is their nutrition like? Lymphedema and scar therapy for patients that have had radiation or surgery. Neuropathy management for certain chemotherapy agents. Self-image is really important. So we talk about reconstruction after treatment for certain cancers. Other things like even financial and social issues that come with having had cancer treatment. Those are all part of cancer care nowadays. And it's really about patients not only surviving their cancer, but as you said, living well.
And continuing beyond that doctor's office and that operating room
Absolutely.
is so important. Dr. Paul Vandersloot, thanks so much for the time this morning.
Oh, happy to join you.
Along with the Sarah Cannon Cancer Institute at Health One and our other partners, we've put together some resources for cancer survivors. You can find those on the Your Health Matters page of thedenverchannel.com.